Hi everyone, my name is Ashley Rutherford and I did my presentation in the class Evidence-Based Medicine on antibiotic treatment compared to an appendectomy in the treatment of appendicitis. I really enjoyed doing this project and I enjoyed researching it, and I hope you find something beneficial from learning about appendicitis and whether antibiotic treatment over appendectomy can be used. So my PICO question was population, adult patients, intervention, antibiotic treatment, comparison, appendectomy, and outcome clearance of appendicitis. My clinical question was in adult patients with uncomplicated appendicitis, is antibiotic treatment compared to an appendectomy as effective in treating appendicitis? So these are some objectives that I want you to take out from this presentation. At the conclusion of this presentation, participants should be able to demonstrate the symptoms, diagnosis, and treatment interventions for appendicitis, apply evidence-based medicine when prescribing antibiotics in clinical practice versus needing an appendectomy, interpret studies that critically appraise the comparison of antibiotics versus appendectomy in patients, and effectively communicate best practical approach for appendicitis to enhance patient care. So I want you to really take out these learning objectives and really think about, whenever I'm going through this slideshow, what is most beneficial for you as a clinician. A little background information: we all learned about appendicitis in school, but I think it's always good to have a review. Appendicitis is inflammation or infection of the appendix, which is a small tube-like structure connected to the large intestine that is located in the lower right abdomen. So in this photo, the appendix is connected to the large intestine and it's connected to the cecum as well, and it's near the small intestine. Appendicitis can be caused due to fecalith or blockage in the appendix. Uncomplicated appendicitis is defined as the inflammation of the appendix without phlegmon, free fluid, or an abscess. So this is some symptoms of appendicitis: nausea, vomiting, fever, lower right side abdominal pain, diarrhea, swelling. Typical symptoms: pain that starts near the umbilicus and moves to the lower right abdomen. And then here is some symptoms of appendicitis with a visual. So you can have the right side abdominal pain, the fever, constipation, no loss of appetite, and abdominal bloating or vomiting. You can also do the physical exam signs whenever you're diagnosing appendicitis. Diagnosis and treatment includes a CT scan. Ultrasound can also be done for patients who want to prevent radiation in children or pregnant patients. And treatment includes appendectomy or antibiotic coverage. Which antibiotic coverage is pretty new, and it's been done in the past like 5 or 10 years, where patients have been given antibiotics over appendectomy. For patients that can't receive an appendectomy, antibiotic coverage can be used, and we're going to talk about the effects and safety of antibiotic coverage over appendectomy. So my hypothesis is treatment for adult patients who receive antibiotic therapy for uncomplicated appendicitis is just as effective short-term compared to those who receive an appendectomy. However, there is a risk of recurring appendicitis and more adverse events in patients who take antibiotics over appendectomy. So why is this topic so important to PAs? So as PAs, we're usually the first line providers that usually will see a lot of these patients. We see them in clinics, in urgent cares, family medicine, emergency medicine. We just see a lot of these appendicitis patients. So it's really important to know what the signs are, know what the symptoms, how you diagnose them, and the best treatment plan for those patients. We all want to figure out the best patient preference plan. So acute appendicitis is one of the most common emergency abdominal surgeries in the world. In fact, appendicitis has an incidence of 1 per 1,000 patients per year. Due to the variable clinical presentation of appendicitis, this topic is important to physician assistants. Delayed diagnosis can lead to complications like an appendiceal perforation or abscess. It can also lead to gangrene or even morbidity or mortality. Recent studies have determined antibiotics can be used in patients with uncomplicated appendicitis over having a surgical appendectomy. So this is important for physician assistants in clinical decision making to recognize antibiotics over appendectomy for patients where a surgical approach is not warranted. So why are we all discussing this now? In the past about 5 to 10 years, antibiotics have been tested on whether they can treat appendicitis over a patient receiving an appendectomy. Antibiotics can give the patient more autonomy and uncomplicated appendicitis to allow shorter hospital stays, less anxiety in a surgical approach, and decreased complications post-surgically. Some complications of appendectomies include infection, incisional hernias, and adhesions that can range from 2 to 23% of patients. And new literature on using antibiotic therapy has made increased progress. So whenever I was researching whether antibiotic coverage over appendectomy was more beneficial, there was tons of articles done in the past 5 to 10 years. I used inclusion and exclusion criteria to figure out what articles were more beneficial for this project, and it ended up being about 3. There was more articles, but these are the 3 that I picked. They ranged from randomized control trials, meta-analyses, systematic literature reviews. So these are one of those articles. So this is a randomized control trial comparing antibiotics with appendectomy for appendicitis. It's a randomized control trial for antibiotic coverage for about 10 days compared to appendectomy in patients with appendicitis. So in this article, there was about 776 patients that received antibiotics, 776 patients received appendectomy, and in the end, the conclusion ended up being about 3 in 10 patients in the antibiotic group had undergone appendectomy by 90 days. So that means that 7 in 10 patients did not receive an appendectomy by 90 days in the antibiotic group. So this was a pretty big result where a lot of the patients did not have to go through an appendectomy within 90 days in the antibiotic group. So that shows that the antibiotic coverage was pretty safe and effective. This is another article. This was a systematic review and meta-analysis. The article was called Non-Operative versus Operative Management of Uncomplicated Acute Appendicitis, and it's a meta-analysis of 595 studies. 8 were utilized to determine the results. So at 30 days follow-up, antibiotics versus appendectomy did not show different results in treatment success. Major adverse effects also did not show major differences in both cohorts. Length of stay in the antibiotic group was longer than in the appendectomy group. In the antibiotic group, there was about 18% of patients that needed an appendectomy done due to recurrent appendicitis. And overall, the antibiotic group was safe and effective compared to the appendectomy group. So like previously stating, there was only about 18 patients in the antibiotic group. So if you really think about it, that's like 18 out of 100 patients that really only needed an appendectomy done due to recurrent appendicitis. This was a meta-analysis of randomized control trials. So the article was called Antibiotic Treatment versus Appendectomy for Acute Appendicitis in Adults. And in this article, there was about 887 total studies. 6 studies demonstrated eligible patients. And in total, there was about 2,101 patients that received an antibiotic or an appendectomy. So about 1,050 patients took antibiotics, while 1,051 patients took an appendectomy. At 1 year, about 5.4% of antibiotic coverage patients had complications, while 8.7% of appendectomy patients had complications. So that proved that there was less complications in the antibiotic group than in the appendectomy group. At 1 year, about 33.9% of patients in the antibiotic coverage group had undergone an appendectomy. So that's about 1/3 of patients that actually had to undergo an appendectomy, but about 66% of patients that took the antibiotics did not have to go through with an appendectomy. So that's a pretty big result where a lot of patients didn't have to go through with an appendectomy. So in conclusion, based on all these articles, antibiotic coverage can be used for appendicitis short-term compared to appendectomy. In the first article, it reported about 7 in 10 patients that did not receive an appendectomy within 90 days. The second article did not report a large difference in complications between antibiotic coverage and appendectomy. And in the third article, it reported about 66% of patients did not have an appendectomy within a year of receiving antibiotics. Therefore, I accept my hypothesis that antibiotic coverage is just as effective short-term in patients with appendicitis. In patients where appendectomy is not warranted, antibiotic coverage can be used in clinical practice for treatment of appendicitis. However, patients receive complications of appendicitis after antibiotic coverage, and an appendectomy should be performed. Antibiotic coverage should be used in clinical practice if an appendectomy is not warranted in patients. So these are all my references. I really enjoyed researching this article, these evidence-based medicine, and researching whether antibiotics over an appendectomy was more beneficial in patients with appendicitis. I really hope that you got something out of this article and that you take this into your clinical practice. I really hope that you have a great rest of your day and a great weekend, and I enjoyed doing this class with you. Thank you so much. Bye.